right, so runner's knee. Bet a lot of you either know it firsthand or are really hoping you never do.
Yeah.
So whether you're marathon running or, just those stairs every day, this is for you. Knowledge is power when it comes to keeping our knees happy.
You hit the nail on the head. And it's funny, it's called runner's knee, but honestly, it can be any repetitive stress. I'm thinking hikers, cyclists, heck, even that intense Zumba class I tried.
Oh yeah, Zumba can get you.
It can. Officially, it's, what is it, patellofemoral pain syndrome? PFPS for short. But Partmon, runner's knee, is just catchier.
Way catchier. So basics out of the way, what's actually happening in there? When we say runner's knee, what's going wrong in the joint?
Okay, so think of it like this. Your kneecap, that's the patella, kind of starts going off track. In that groove on your thigh bone, the femur.
So not supposed to do that.
Not at all. And all that leads to, well, friction, obviously, inflammation, and the longer it goes on, even cartilage can get damaged. It's like, I don't know, a train jumping the tracks. Rough ride.
Oof. Yeah, that imagery works. So what causes that? I mean, is it literally just running too much or?
Rarely that simple. Usually it's a few things piling up. But weakness is a big one. Muscles, especially hips, glutes, quads, if those aren't strong enough.
They're supposed to be supporting the knee so it stays aligned, right?
You got it. Weak support equals wobbly kneecap, basically.
Makes sense. Like building on a shaky foundation, the whole thing's going to be off.
Perfect analogy. And speaking of foundations, training mistakes, those are huge culprits too. All our sources agree on this. Too much too soon. That no pain, no gain mentality.
Not listening to your body.
Precisely.
Yeah.
That's a recipe for knee trouble for sure.
Yeah, it's tempting to push it, especially when you're starting out, all that enthusiasm. But I guess we got to respect the signals our bodies are sending, huh?
Huge, yeah. Pain is not a badge of honor. It's information. Your body's talking. Gotta listen. And then there's biomechanics too. How we're built, how we move. Flat feet, high arches, that overpronation thing.
The foot rolling inward too much.
Yep. Throws everything off, puts extra stress on the knee. So it's not just the knee in isolation, it's the whole system.
Whole body situation. Okay, so we've got weak muscles, pushing too hard, how our body's built.
Yeah.
Anything else adding to this runner's knee mess?
Oh, can't forget shoes. Good shoes make a huge, bad difference in how that whole system works support-wise. Bad shoes, well, they can just make existing problems worse.
We'll get to shoes specifically later, I'm sure. But yeah, the right gear matters.
Big time. Okay, so symptoms now. How do you know it's runner's knee, not just some random ache?
Right, because pain is pretty generic.
It is. Pain's the obvious one, but it's not always constant. More like you do certain things, then it hurts. Running, of course. Squats, stairs.
Or even just sitting for too long. That's the one that gets me.
Yeah, that can happen too. So definitely not just runners get this, but other signs. Some folks get swelling around the kneecap. Not always dramatic, but it's there.
Puffiness, yeah.
Anything else?
Sometimes people describe it as like a grinding, creaking inside the knee. Ooh, not good. Makes me think of like an old rusty hinge or something.
Yeah, similar vibe. And then that stiffness you mentioned, but after rest. Like you get up after sitting and it hurts to start moving again.
That's my life.
Yeah, well, that's a sign too. Okay, so who's most likely to deal with this? We've established it's not just T runners.
Yes, they're like a runner's knee profile.
Kinda, yeah. Intense training, bad form, those are biggies for athletes in general, but also beginners. They'd all gung-ho, overdo it before they're ready.
Enthusiasm backfiring.
Yep. Weekend warriors too, all-out effort, then nothing all week. And anyone with those pre-existing things, flat feet, high arches, got to be extra careful.
Right, like their foundation's already a bit wonky to begin with.
Exactly. Oh, and our sources all mention this. Women are more prone to it too.
Figures. Why is that? Something about our hips, right?
Yep. Wider pelvis, different angle between the thigh bone and kneecap, puts more stress on the joint.
Not fair, but good to know. Okay, so say you're already feeling the pain. What do you do about it? Like right away.
First things first, good old RICE. You've probably heard it. Rest, ice, compression, elevation, especially when it's just starting, inflammation's at its worst.
So basically, be nice to your knee.
Exactly. But let's break it down a bit. Rest doesn't mean become a couch potato forever. Just dial back the stuff that makes it hurt,
I'll give it a break.
Yep. And ice. There's a rhythm to it. 20 minutes on, 20 off. Gets the swelling down without cutting off blood flow too much.
That'd be bad, right?
Yeah. You don't want to hinder healing by icing for too long. It's a balance. Now, compression, that's about support and, again, reducing swelling. Elastic bandage, compression sleeve, whatever works, but snug, not cutting off circulation.
Like a nice firm hug for your knee.
There you go. And elevation, a lot of people skip this, but it's huge E. Gets gravity on your side, helps drain that fluid.
So up on some pillows when you're resting and icing.
Ideal, yeah.
Okay.
Above heart level if you can manage it. Okay, then there's pain meds, the over-the-counter stuff. Helpful.
I mean, they take the edge off.
They do, short term, but they're not a solution. Relying on those too much, you might mask the problem, not actually fix it.
Right. Got to deal with the root cause.
Exactly. So back to running itself. That's the tricky part.
Yeah. When can you start again? And how W?
Slow and steady wins the race, literally in this case. Start with walking, build up to walk-run intervals. Only increase the running bit when you're truly pain-free.
So even if you feel ready, get ease back in.
Big time. And surface matters too. Softer is better at first. Grass, treadmill, less pounding on the joint.
Because pavement's brutal, especially when you're recovering.
It is. And overall, pain is your boss. Any pain, you back off. No pushing through it. That's just asking for trouble.
Tough love from our bodies.
Yep. Now, on top of running itself, there's rehab exercises. Targeted stuff to strengthen what needs strengthening.
Muscles that'll support the knee better, right?
You got it. Straight leg raises, those are great for quads. Lying flat, lift one leg up, keep it straight.
Sounds easy enough.
Deceptively so. Wall sits too, these are good. Back against the wall like you're sitting in a chair. Hold it. 20, 30 seconds.
Oh, I've done those burr ends.
In a good way, yeah. Quads and glutes, working hard there. Then there's clamshells. These are for glutes specifically. We tend to neglect those.
Important though, seems like everything's connected.
Big time. And all these exercises, you can start simple, then add resistance bands, weights as you get stronger.
Good old progression.
Yep. Oh, and foam rolling. Can't forget that.
This seems to be trendy these days. Is it actually helpful or just hype?
Super helpful. Think of it like a self-massage, deep tissue stuff. But for runner's knee, you got to target the right spots.
Which are?
IT band, that's the one everyone talks about. Runs down the outside of your thigh, hip to knee. Tight IT band pulls on the kneecap. Bad news. But also, quads need rolling, and even calves, believe it or not.
Wait, calves? Why those?
Because tight calves mess with your ankle, and that messes with your knee. It's all a chain reaction.
Body's complicated.
It is. Okay, so we've covered a lot you can do yourself, but when is it pro time? When do you see the doctor, physical therapist, etc.?
Where's the line?
If you're doing all the right things and the pain's just not budging, red flag. Especially if it's like affecting your walking, your daily life.
Right, if it's beyond just running discomfort.
Yeah, then something else might be up. Also, if you're having trouble actually putting weight on the leg or the knee feels wobbly.
Like it could give out.
Exactly. That needs checking, could be more serious. And of course, if there's swelling, redness, that unusual warmth, that's not just runner's knee, that's something else.
Infection or...
Could be, yeah. Needs medical attention for sure.
Okay, so better safe than sorry. So much good info on recovering, but prevention's even better, right?
Absolutely. Avoiding this mess in the first place, that's the goal. Ready to dive into that.
Bring it on. Let's prevent some runner's knee.
All right. Welcome back to our knee-saving extravaganza, or, well, runner's knee specifically.
Part 2, diving deeper into how to keep those joints happy. Last time, we covered what an IS, how to kind of put out the fire when it flares up.
Right, the basics.
But this time, it's about, okay, you're on this journey now. What resources? What next EA steps? Where do we go from here?
Well, we touched on some pros already. Physical therapists, those folks are amazing. They don't just treat, they figure out what's going on specifically with you.
So more than just like generic exercises or whatever.
Way more. They assess your whole situation, like how you move, any underlying problems. Then they build a plan just for that.
Like knee detectives.
I like that. They understand biomechanics, the whole structure, and they can do hands-on stuff too. Manual therapy, taping, helps with pain and defunction.
Yeah, that's good to know. Now, what about if you're like brand new to running? Is there help specifically for starting out right?
Absolutely. Running coach is your best friend there. They'll teach you good form from the get-go so you're not building bad habits.
Because those are hard to break.
They are. Plus, a coach makes you a plan that's safe, effective, and they keep you motivated, which is huge. Ew.
Accountability, buddy.
The best kind. And hey, community's huge too. Running groups, online forums, all that. You connect with people, share tips. It's encouraging.
Because everyone's going through the same stuff or has been there.
Exactly. Misery loves company, but also success loves company. Oh, and of course there's info online. got to be careful there. But reputable sources, American Academy of Orthopedic Surgeons, Arthritis Foundation.
Not just random blogs.
No, stick to the evidence-based stuff. But those websites, they have tons of good info.
And speaking of info, self-education in general, don't underestimate that.
Going beyond just this deep dive, yeah.
Totally. Books, articles, heck, even other podcasts.
That were pretty great, I gotta say.
You are. Point is, the more you learn about runner's knee, prevention, recovery, the better equipped you are to make good choices.
It's like knowledge is your armor.
Love that. Okay, want to circle back to those red flags real quick. Just to drive it home, when do you absolutely need that pro help? Yeah, worth repeating.
It is. So pain that's just hanging around no matter what you do at home, that's suspicious. Especially if it's limiting you. Like, you can't do normal stuff.
Or the stuff you enjoy doing.
Exactly. If you're constantly working around your knee pain, time to get it checked. And then the sudden stuff. If it comes on strong, out of nowhere.
Yeah, different feeling.
Totally. And especially if there's other stuff along with it, swelling, redness, the knee feels hot.
Like feverish hot.
Yeah, that kind of warmth. That's not just runner's knee. Something else is going on. Could be serious. Needs a doctor. ASAP.
No messing around with that.
Nope. And two other things to watch for. If putting weight on that leg is hard, or if the knee feels unstable, wobbly.
Like it could buckle?
Yep. Get that looked at too. So basically, anytime you're like, is this normal? Better to ask a pro than risk it.
Makes sense. Okay, so we've established sometimes pros are needed, but good news is it's not always the scary stuff.
Oh, definitely not. Surgery is like, woo, the last resort usually.
Yeah.
Plenty of other options before we get there.
What kind of stuff?
Well, physical therapy, we talked about that, but also bracing, that can help a lot. Gives extra support, takes pressure off the joint so it can heal.
Like a little external support system.
Exactly. Yeah. Medications too, simple stuff, over-the-counter pain relievers, or if it's bad, the doc might give you anti-inflammatories.
Stronger stuff.
Yeah. And then if those aren't enough, there's injections. Corticosteroids, hyaluronic acid, those can help with inflammation, make the joint move better.
So it's not just one size fits all. There's options depending on what's going on.
Absolutely. Pro's going to figure out the best approach for you. But remember, even with pros, you being informed helps a ton.
Knowing what questions to ask, understanding what they're talking about.
All that. The more you know, the better you advocate for yourself. So yeah, runner's knee sucks, but it's not a hopeless situation.
There's stuff we can do.
Tons of stuff. This deep dive's just scratching the surface, honestly. It's a journey. Got to keep learning, keep trying things.
Find what works for you.
Exactly. Okay, want to switch gears a bit. We've talked about the knee itself a lot, but shoes. We got to talk shoes.
Oh, yeah. Those matter big time, Riff.
Huge. Often overlooked, but crucial for knee health. Where to even start? Fit is everything. Snug, but not too tight. Enough room for your toes to wiggle.
I've heard your feet swell when you run, so got to count for that.
Smart thinking, yeah. And then, the type of support you need, that depends on your foot, how you run.
What do you mean how you run? Like everyone runs the same, don't they?
Oh, not at all. Some folks have high arches, some flat feet, some in between, and then the way your foot rolls as you move. Overpronation, underpronation.
That's the inward-outward rolling thing.
Yep. All that affects how the forces travel up your leg, into your knee. So that gait analysis we mentioned, at a good running store, worth it.
Because they can see how you actually move, recommend the right shoe.
Precisely. Don't be shy there. Ask questions, try on a bunch of stuff, find what feels good for your foot, your way of running.
Because you can be spending a lot of time in those shoes.
You are. And hey, your needs might change over time, so don't be afraid to reassess every so often.
Okay, good advice. Now, what about if you need more than just a regular shoe? Like extra support?
Orthotics. Those are your friends. If you've got flat feet, high arches, any of those things that throw off your mechanics, game changer.
They go inside the shoe?
Yep. Custom-made inserts give you that extra love where you need it, helps align everything properly, takes stress off the knee.
So it's worth looking into if you've got those underlying foot issues.
Totally. Okay, now, the big debate. Minimalist shoes versus cushion shoes.
This one always gets people fired up.
It does. Minimalist, the idea is to mimic running barefoot. More natural motion, makes your foot muscles work harder, which can be a good thing.
But also harder, right? Like more impact.
It can be. Got to transition slowly, build up those muscles. If you jump in too fast, could be trouble. And if you've already got knee pain or any injuries,
maybe not the best idea.
Talk to a pro first, for sure. Now, cushion shoes, those are the popular kids these days.
Comfy, I get it.
Right. And they do absorb more shock, which is great if you've got joint pain, if you're new to running or running on hard surfaces all the time.
So there's a place for them.
There is. But tricky thing is that cushioning can hide bad form. If you're not moving efficiently, the shoes kind of mask it, but the stress is still there.
So you could be hurting yourself without realizing it.
Exactly. Got to be mindful of form no matter what you're wearing.
Hmm.
So bottom line, best shoe is what feels good to you, gives you the support you need, and lets you run pain-free.
Personalized shoe shopping.
Yep. Trial and error sometimes, find what works. Okay, one more thing I want to touch on. Food. What we eat matters for our knees, right?
I mean, it matters for everything, so probably.
Big time. Whole body's connected, and some nutrients are especially good for supporting those joints, preventing runner's knee.
Hit me with the knee-friendly grocery list.
We already mentioned omega-3s. Those are your best friends.
Hmm.
Anti-inflammatory powerhouses fight pain and swelling like champs.
And we find those in.
Fatty fish, the good stuff. Salmon, mackerel, sardines. If you're not a fish person, no worries. Flax seeds, chia seeds, walnuts, those work too.
Okay, good to have options.
Yeah.
What else?
Vitamin C, super important. That's what helps us make collagen, which keeps our cartilage strong and healthy.
So oranges, berries, all that good stuff.
Exactly. And if you want to go the extra mile, collagen supplements are a thing now.
I've seen those around. Do they actually do anything?
Collagen is what our connective tissue is made of, cartilage included. So supplementing can give your body more building blocks, basically. There's different types, some specifically for joints, so do a little research.
Good to know. Now, what about bone health? Calcium, vitamin D, that whole thing.
Can't forget those. Strong bones are the foundation for everything. Dairy, leafy greens, fortified foods, those are your calcium go-tos. And vitamin D helps you absorb it, so sunshine's your friend.
Gotta love a sunny day.
Seriously. Oh, and this seems obvious, but hydration. Can't skip that.
Water, water, water. We hear it all the time.
For good reason. Joints need it to stay lubricated, move smoothly. Think of it like oil for your hinges.
Okay, that makes sense. So how much are we talking? Like gallons a day?
Not quite. General rule is ½ ounce to an ounce per pound of body weight, but depends on how active you are, the weather.
So basically, drink when you're thirsty. That's the best gauge.
Exactly. Your body's pretty smart about that. And hey, fruits and veggies, even soup, those count towards your fluids too.
Staying hydrated however we can.
Right. Okay, want to get a little deeper. We've talked body stuff a lot, but what about the mind-body connection, all that?
Intriguing. What's that got to do with the runner's knee?
Well, think about it. When you're stressed, don't you feel tighter in general? More aches and pains.
Now that you mention it, yeah.
There's a reason for that. Mind and body are way more linked than we realize. Stress messes with us physically, big time.
So, like, my anxiety could literally be making my knees hurt.
It could, yeah. When we're stressed, our body pumps out cortisol, that's the stress hormone, and that stuff, it causes inflammation everywhere, joints included.
So managing stress is part of taking care of our knees.
Huge part. Yeah, find what works for you, exercise, meditation, being in nature, whatever chills you out.
Yeah.
That's good for your whole self, knees included.
Stress management is knee therapy. I like it.
It's a thing. And while we're at it, sleep. Can't underestimate good sleep.
Oh, yeah. Sleep is the cure for everything, it seems like.
Pretty much. When you sleep, your body repairs itself, builds stuff up, reduces inflammation.
Like a nightly reset button.
You got it. 7 to 9 hours, good quality sleep. That's what we're aiming for.
Okay. Noted.
Mm-hmm.
Stress less,
Right.
sleep more.
Mm.
What else can we do for that whole mind-body knee connection?
This is going to sound cheesy, but honestly, listen to your body. It'll tell you what it needs.
Easier said than done sometimes.
It is, but I mean, really pay attention. What are you feeling? Physically, emotionally, mentally, all of it.
Tuning in, basically.
Exactly. Pain means something. Tiredness means something. Don't push through it. Figure out what your body's trying to tell you.
So it's like respecting our body's limits.
And needs, yeah. Be kind to yourself. Treat your body like a friend, not a machine.
I can get behind that.
Yeah.
It's a journey, this whole knee thing and life in general, right?
Very well said. Not about perfection, just about taking care of ourselves the best we can.
All right, so much good stuff in this part 2. But we're not done yet. There's more to come in part 3.
Oh, yeah. Still got to dive deeper into some stuff. Get even more specific about runner's knee. Stay tuned.
All right, final part of our runner's knee deep dive. Hopefully your brains are full of useful info by now.
My brain's definitely full. But there's always more to learn, right? And I think this last part, it's kind of bringing it all together.
Good way to put it. We've talked about what causes it, how to recover, how to prevent it. But I want to circle back to seeing a pro. We've mentioned it throughout, but it's worth emphasizing.
Totally agree. As much as we can do on our own, sometimes you just gotta call in the experts.
And that's not giving up or admitting defeat or anything.
No way, it's about being smart. Knowing when you need more help than, like, a foam roller in some stretches can give you.
Exactly. So, last time, those red flags. Worth going over one more time.
Yeah.
When do we stop DIYing it and get to a doctor?
Okay, so, big one. Pain that's just not quitting. You're resting, icing, doing the exercises. Still hurts. Suspicious.
Especially if it's, like, impacting your life.
Huge, yeah. Can't do your normal activities, the stuff you enjoy. That's not right. Pain's trying to tell you something.
Right. It's gone beyond just a runner's thing at that point.
Exactly. And then the sudden, intense pain. That's different, especially with other stuff going on at the same time. Swelling, redness, the knee feels warm.
Like more than usual.
Yeah, like almost feverish.
Yeah.
That's a sign it's not just your typical runner's knee. It could be something that needs attention.
Ligament tear, all that scary stuff.
Potentially, yeah. Don't want to mess with that. Oh, and if you can't put weight on that leg, or the knee feels unstable, like it could give out.
Makes you nervous to even move.
Right. Get that checked out, too. So anytime there's doubt, pro opinion is better than regret later, you know.
Makes sense. Okay, so say you DOC a pro. Good news is it's not always surgery, right?
Oh, good news indeed. Lots of options before we go down that road. Physical therapy, we're big fans of that. Strength training, flexibility, figuring out how you movie.
Addressing all the underlying stuff.
Yep. And sometimes a brace can help a ton. Just that extra support takes pressure off, lets the joint chill out and heal.
Like a little helper.
Exactly. And meds? Sometimes those are needed. Basic pain relievers, or if it's bad, your doc might give you something stronger, anti-inflammatory stuff.
To knock that swelling down.
Yeah. And if those don't do enough, there's injections, corticosteroids, hyaluronic acid, stuff like that. Helps with inflammation, lubrication in the joint.
So many options. It's not just one thing they do for everyone.
Nope, very personalized. The pro will figure out what's best for you. But even then, you being informed helps so much.
Like knowing what to ask, understanding what they're saying.
All that. You're part of the team, basically. So yeah, runner's knee can be a pain, literally. But it's not the end of the world. There's stuff that can be done.
And it's worth doing. Because
Yeah.
running or just moving freely, that's important.
Huge GE. So much of our life depends on our knees working.
Right? Makes you appreciate those joints, that's for sure.
Right.
Well, this deep dive, I feel like we've covered so much.
We have causes, symptoms, prevention, recovery, even the mindset stuff.
And when to get help, which is key. But like you said earlier, it's a journey, right? This is just the start.
It is. Keep learning, keep paying attention to your body, and don't give up. Happy knees are possible.
That's a great message to end on. Thanks so much for all the knowledge.
Anytime. Happy to help keep those knees moving. And everyone listening, good luck on your journey. Take care of yourselves.
Until next time, folks, keep exploring, keep moving, and most importantly, stay curious.